Well, thank you for staying with the Monday Report. This conversation is still continuing even during the break, and my guests are still with me. Engineer, is this just a government responsibility alone, the fight against HIV and AIDS?
Not really. It's for all of us.
Yeah.
I can tell you that in corporations where I've worked in the past, and some even now, when you begin to look at the management of HIV in a company, you will find that your health costs, specifically when you intervene with HIV, will drop by almost 10%.
Yeah.
Just the health management cost. As simple as that. Provide ARVs without any, without any blinking an eyelid. Provide all the dietary supplements that are required,
yeah,
and get free testing at any time that people require it. Yeah. And the minute somebody is tested and they've got HIV, onto ARVs straight away, no questions asked. We did that in several companies where we have been involved, yeah, and we saw a big drop in our health in our health bill.
Yeah.
So you apply that and you go across the whole of the health, or across the whole of the health spectrum.
Yeah. You
can reduce your overall burden on the company by almost 40 to 45%.
Yeah.
There are those where you can't take, you have to keep curing, as Dr. said. You go to continue the curative area. There are some non-communicable diseases whereby effectively once you get them, you've got them.
Yeah.
And you've got to look after them. Yeah. The communicable ones, you've got to start and break that essence of communication.
Yeah.
And a company can invest in those programs, and it actually makes good business sense to do so.
Yeah. But why can't the private sector just step in terms of social responsibility and come up? You are the one who mentioned the prevention rather than the treatment part of it.
Yeah.
Why don't you come up with a campaign of some sorts whereby everybody then has the buy-in, because the government seems to have been lagging behind on that? Why is it so hard for the private sector to just come up with their own campaign that they're now just going to push?
For the private sector to take that on, they need to be guided by experts. And that's the government, that's the public health department,
yeah,
the public health people. They have to design the right campaigns, and the private sector can then join in and put resources in.
Yeah.
We were talking about corporate social responsibility. That's a word that the private sector just does not accept anymore.
Yeah.
It is socially responsible corporates.
Okay.
That's the buzzword these days. So you become socially responsible corporates, i.e. you are looking after the environment where you are, the people that you're working with, your stakeholders, and so you become a socially responsible corporate.
Yeah.
But if there's a good program that has been designed that can impact on the community around where you are working as a socially responsible corporate,
yeah,
we will invest, because those are our customers. Those are the people who are going to consume our products in the long term.
Yeah.
And if they are falling off all the time, where's our business going to come from? And that's why we talk about socially responsible corporates.
Okay.
Because there's got to be a return to us as a company,
yeah,
but you've also got to recognize that what we invest in will have a social impact in the areas that you're working in.
Yeah.
So it's up to the government to design a program, bring it and say, we'd like you to participate in this area, and we'll work together. And if it makes good business sense, I can tell you a lot of private sector companies will invest, yeah, in those programs and take the burden off the government.
Yeah.
But to expect that the private sector companies are going to come together to design it, that's not going to happen.
Not going to happen. No. Dr. Wino, what will be the best private-public partnership model that will then help in the fight against HIV?
Well, traditionally, we have actually relied on the public sector, for domestic resource mobilization.
Yeah.
And I think we have actually reached to an extent whereby we now need to look elsewhere. Mm-hmm. And in my case, I think the private sector really plays a key role. And if we look at, even in terms of ownership of facilities, it's more or less 50-50, the private sector about 51%. And 80% of NHIF reimbursements actually go to the private sector. We are also seeing, as the donors' funding is dwindling, we are seeing a gap that can only be filled by the private sector, if we really compare. So coming back to your question in terms of some of the models that I actually see, I think one was actually mentioned, in terms of manufacturing. And it really has to be where, as my colleague will say, there is an investment case. We also need to look at areas where, as a country, we do have a competitive advantage, where we could also exploit the regional blocks. We also need to look at the partnership between the public and private sector, even in terms of sharing, let's say equipment, sharing personnel, human resource. These are arrangements that can actually be worked on. And based on the experiences that we have, bulk of the health workforce actually work in both private and public sector. So what's really critical is for us to be able to see how best this can actually work. So there are very many models that can actually be agreed upon, but the whole thing is that both groups really need to sit down, and this actually would better be articulated in the health finance strategy, which I know we are almost towards the finalization, because that is a key document that actually gives, the mix in terms of the funding and the how. It really addresses the issue of the how. And let's also not forget, when you talk about the models of healthcare financing, we do have the out-of-pocket spending, where we're actually asking individuals, to be able to make the payment. But the challenge with that is that high out-of-pocket spending will really impoverish the public. Then we do have the government, and I did mention about the macro-fiscal constraint, so that's also a real issue. And then the other one is the development partners, which also includes the TA. Now that's also dwindling. So where are our eyes? Our eyes are actually in the private sector. So really, what we need to do is really to get a formula that really works. But the only entity that can bridge this gap, especially in this transition period, is actually the private sector. And my colleague will let you know that we do have the Kenya Health Coordination Framework, which really articulates how we can actually work with the private sector. And we can actually look at this document and see the respective areas where we can actually work in. Otherwise, the potential is there, and what we really need to be is to come up with the prudent stewardship, leadership to be able to drive this specific process.
Okay, Dr. Ngugi, the challenge has been thrown back to you. Show the leadership, and the private sector will come through.
In fact, as we discussed right now, we are borrowing from the document Prof has just mentioned. We are developing the private sector engagement framework the first time, the National AIDS and STI Control Program, because we have realized that we cannot really attain the targets that we have set as a country without the private sector engagement. And that is why that I will be launching it within the next 2 months, and to see tapping into the different areas. How do we engage with the private, not only in prevention, but as well as in linkage, and as well as on treatment as well. Because even the medication that we have, HIV drugs in the country are free, bought by government or through multilateral or bilateral donors. So when the private sector comes on board, so what are they bringing? We need to discuss them. What are you bringing on board? But as well, changing from the word of corporate social responsibility, it is now socially responsible corporate, to ensure that all of us then can sit at the table. We can attain the targets and then meet the targets are put for the different indicators in the country. But I think it is time, definitely, think beyond the public sector and go to the public-private partnership. And I know we can attain the targets that we have. Thank you, Trevor.
In which categories now is the most rampant HIV spread? Because this changes all the time. Is it in the categories of young people? Is it married couples? Because the last time I checked, it was married people, and then it moved to young people. Where is it most prevalent right now?
Adolescents and young persons. adolescents 15 to 24, in terms of, for every 100 new infections we have in the country, 60 of them are between the ages of 15 to 24. Okay, draw it down now. For every 10 people infected in the country each year, 6 of them are between the ages of 15 to 24.
Okay.
And you know all the characteristics of that group.
Yeah.
Yes.
So 15 to 24, are you concerned about the spread? Is it bilateral spread? Are they spreading with other categories? What is the issue here?
It is mixed with the older and as well within their age mates as well, but as well as with the older people. Because even within the 15 to 24, it's more on adolescents, girls, and young women. And you know that's an age that we are having issues of being maintained. This issue of sugar daddies, I don't know the new word nowadays, that
sponsors.
Engineer says it with confidence.
Yes, it's sponsors. That's the age. And then remember, when they move from that age group, they come back to their age mate as well, because they still want to mingle and be able to relate with their peers, with their age mates. So it is still across. And as well. And
now that is where my concern is. So what is the messaging to this particular group of people? Because they seem to be reading from different scripts. What is the messaging for them to hear that they need to prevent themselves from acquiring HIV? Okay,
first of all, is to realize that HIV is still an issue in the country. Not only HIV, but other sexually transmitted infections. Chlamydia and gonorrhea, within that age group, the prevalence is 29%. And yet we can be able to treat chlamydia and gonorrhea, but we are worried more of infertility. So within the next 5 to 10 years, we'll be worried, especially to those adolescents, girls and young women, about infertility. But to this age group, I think I'll just tell them is that the need to know about, learn more about sexually transmitted infections and take the precautions that come with it. But as well as, it comes to matter of relationships with the older generation. I don't think I'm an expert in that area, but it's a way that how can they be able to grow with their peers, delayed abstaining, being faithful, use of condoms. If then they cannot use condoms, use pre-exposure prophylaxis to ensure that they prevent the transmissions of the virus to them. But I think empowering them is key. When we have gone around the country and looked at the data that we have realized the coupling of new HIV infections among that group, increased teenage pregnancies among them, and as well as increased mother-to-child transmission of HIV. So not only are they infecting themselves when they are being infected, but as well as they're transmitting that virus to the young ones, either during pregnancy or during breastfeeding, which is, I have mentioned, around 11%. So meaning there is need for us as a country to look at this triple pandemic beyond the COVID-19, because this is our future generation. When we look at our demographic in the country, almost 70% is made of the young people. So 10, 15 years from now, who will be the one contributing to the GDP of the country if they are infected and they are being limited by the virus? And knowing, as I have mentioned, maintaining one client who is HIV positive per year is around 7,000. If they fail on the first line and we move them to the second line, it's almost triple, it's almost 21,000, which is not sustainable. So there's need for us to put in measures and prevent HIV transmissions to the young people.
All right, let me bring in some of the feedback that I'm getting here. Afiatech says actually the biggest hindrance to corporate responsibility to preventive health is the regulations enforced by the authorities. They can't take a simplified model, but yes, it can be done. Let's see what else is happening here. Leonard Keter says, fight corruption, increase domestic funding, and realign inefficiencies in the healthcare system. That is the solution. Methusela Onguso says, I guess options would be found in the national vision and not in isolation. But do we even have such a vision to begin with? In fact, that is true, engineer, because we're thinking of having a strategy to raise the much needed resources for ending AIDS by 2030. What would that entail, considering we're dealing with that pandemic right now?
I think we have to define the end game. First of all, where do we want to be? right? And then work backwards to now, and then put the steps in place. It's as simple as that. That is how you design it. But that will require, I think, a clean sheet, and bring in the experts in, bring in the people who got the money, bring in the people who are just thinkers, people who will look at things, and lock them in a room for a month or whatever it is, feed them, and tell them we'd like you to really come out with something that will take us to that place. Vision 2030 was born in a similar manner. You had the National Economic and Social Council, which had all these crazy people. You had academics, you had religious people, you had thinkers, you had all these people put in a room. And regularly they used to discuss openly about almost anything. And Vision 2030 was born out of that. Right? And similarly, when you're talking about trying to achieve something that looks unachievable, right, you really need to have some radical ways of looking at it. Right? I mean, I'd like to challenge Daktari here, just on the issue of why we are getting these cycles and the youth are coming in. We have nothing on TikTok. We have nothing on Facebook. We have nothing on Twitter and all the rest of it around these campaigns. We are still doing them in exactly the same way we've always done them. So we need to, we really need to go down to where those guys can, you know, it needs to be a campaign that is a touch and feel at that kind of level. Now, who designs that? It isn't. It is the people at that age who have got to design that kind of intervention. Not the people, not the likes of myself, who do not understand the dynamics of that level. So even if you're designing those interventions going into the future, we have to get the right people on the table. Right? And now you talk of private sector, public sector, whatever it is, let's look at populations. And the populations that are affected and infected are the ones that should design that those interventions, because they're the ones who are feeling the pinch. Right? But too often we get the experts to design. And when you do that one, we don't know how those guys are going to react. So I think we need to make a radical change in terms of having this final push to get us to a position where we are comfortable, we are managing it, and it's at a kind of, you know, the new infection rates are down at the sort of 1 to 2%, that kind of level, which is where I think we should be, right? And then also when you're talking about you know, about this transmission and all the rest of it and so forth, bring it right down. But it is not going to happen if we still do it the same old way we've always done it.
Dr. Wino, you know what Methuselah is saying here on Twitter relates to what we were talking about earlier on. The Abuja Declaration, health sector funding should be about 15%. Kenya has been allocating 6% for the longest time. So it's not really a lack of plan, it's more about implementing those plans, right?
Well, this brings in several issues, Trevor. One, of course, we talk about is the money available? You know, we know, for example, out of the revenue that we generate, we have to pay our debt. We also need to support the central functions. You know, there are so many things that we really need to do. So the issue is that it is doable, and what we actually need to do is, you know, to be able to push, and it is good we have actually started. You know, we have already started one step. So I think what I would just say is we really need now to, you know, we are there. And I think the aspect of the country moving to a lower and middle income status and the decline in donor funding, because donors also have their priorities, and priorities change. So to me, it's actually a wake-up call, you know, to this country. And I would say that with the gesture that we actually saw, you know, the other day in the budget, you know, we are really in the right direction. And just let me say something that we may miss in this discussion. And we have been concentrating on the supply side. And we have not actually looked at the demand side. And in this case, if you look about the demand side, is how does the population access these services? We have about 26% of the population are poor. So issues of access, you know, issues of financial access are very, very critical. And that's why, for example, when my colleague talked about the poor accessing, HIV is free. HIV services. But there are these additional costs. There's the transport.
Yeah.
There's the food. There are additional costs that one really has to incur when you actually obtain the services. And that's why the government's efforts towards financial protection is very, very important. And I would actually applaud both levels of government, because we also do have counties that are already paying for the indigent population. So when you have the counties paying and the national government paying, then that really brings in a very, very good pool.
Yeah.
And we cannot stop this discussion also of financing without talking about NHIF.
Yeah.
And I know there are so many reforms that are actually going on, in NHIF. And one of the most critical ones, I think I would look at two, which would be very, very significant, which to me would actually be a game changer. One of them is the pooling of the resources, so consolidating the various schemes. NHIF has more than 74, schemes. So if you can actually consolidate this, because one of the challenges of having so many schemes is the administration expense. It's very, very expensive. And I would like to give maybe just one or two examples.
Yeah.
We do have the EduAfia, which is actually for secondary school students. And as we sit here, these are students who are within our household, and they're also covered with, they are under the normal schemes. So why can't we actually consolidate, such schemes? Of course, I know there are so many schemes, but that would be very, very critical.
Yeah.
And we should also fast track the reforms towards making the NHIF to be a strategic purchaser. That's something which is really very, very key, and it will be quite instrumental.
Yeah. All right. And to give you a chance for closing remarks, each, and I'll start with you, Engineer. Where do we go from here as a country in the fight against HIV?
I think as I said earlier on, I think we just need to completely rethink how we are going to tackle HIV. The demographics have changed. We've now got the whole area of social media, internet, and everything that has come through.
Yeah.
And we need to rejig, refund, and then rearm. Simple as that. And then once we've done that, I'm sure that we'll be able to reach those populations that currently we're not reaching effectively, and also get them to change, because we're talking in their language.
Yeah.
But that language changes like Sheng.
Yeah.
And we've got to be agile enough to be able to move at the rate at which Sheng changes within the populations where we are. But also, when you talk about funding, there has got to be some key things present if you talk about putting funding in. There's got to be integrity of management of the funds. There's got to be complete transparency and accountability, but also co-management. Whilst that is a government thing, I think there should be co-management of those funds, especially if the private sector is putting money in. We want to make sure that we're getting full value for that money.
Okay.
Thank you.
All right. Dr. Ngugi?
Oh, thank you. I think, first of all, is to applaud the nation and the county government for the steps that are being taken, especially what we saw last week.
Yeah.
It's a way to go for sustainability. Secondly, is to ensure that there's efficiency, the need for integration, utilizing especially the primary health care on the ground, knowing right now that the gaps more are within the communities. And my third point, as I come to the final one, is the need for the private sector sitting on the table and seeing how do we partner together. And finally, for the new HIV infections coupled with the other issues with teenage pregnancies and MTCT, we have had definitely the TikTok, the Facebook, the Instagram, and we will ensure that we change the strategies and interventions that we can be able to reach out more so to the adolescents and young persons.
Okay.
Thank you very much.
Dr. Wino?
Yeah, I would like to say three things. The first one, we really need to acknowledge that it is our responsibility as a country, and also as per our constitution, to be able to provide health services, which also includes HIV. And as my colleague mentioned, we are in the right direction, based on the recent budget that we have. And as we actually move forward, what we'll actually need is prudent leadership to be able to design, sustainable resource mobilization strategies. And working together, in spite of the limited macro fiscal space, we'll make it.
Okay. Thank you so much for making time, Dr. Pius Owino, Health Finance Expert, COG, Dr. Catherine Ngugi, Head NASCOP National AIDS and STI Control Program, and Engineer Patrick Obath, Chairperson, KEPSA Foundation. I see a lot of your feedback here. Let me try and squeeze in a few of them really fast. Fahe K says, even with the donated ARVs in this country, access to them is still a challenge. Young people living with HIV, lives are threatened. What's Kenya without ARVs for its people? Okay. Mtetezi Vini says the solution is unless we end the corruption in this country, there will be no day we depend on ourselves. All right, let's see also here you say thousands of NGOs in Kenya which are supposed to fight spread of HIV and AIDS because they're cash cows for foreigners and employees of those bodies. They don't have the best interest at heart. And Galgalo says since the Kenya government are not ready to set up a manufacturing center due to the issues facing the country and other issues arising, the government should give the private developers or private hospitals permission to start manufacturing the ARV medicine and make it available locally. All right, that's all the time we had. Thank you so much for tuning in. Until the next time, we'll see you again. Stay with Citizen TV. Bye for now. Good night.